Hi, I'm Dr. Kelly Starrett with H-Wave. Today we're going to talk about words that you may have heard before and somehow get confused about when we're talking about injury. And those words are swelling and inflammation. So let's break down just quickly what we mean when we're using H-Wave to manage swelling. Swelling is usually a result of an inflammatory process. So if I've had surgery or I've had issues of like tissue trauma or broken a bone or sprained something, part of the way that the body heals itself is by initiating an inflammatory cascade. And there's a lot of very complex machinery that gets put into motion after some trauma or after some surgery. And that literally is how the body starts to call in other cells, how it repairs itself through that sort of signaling of that inflammatory cascade. A side effect of that inflammatory cascade, which is vital for healing, a natural healing response that we don't want to limit at all if we're going to maximize our healing response to these things, is swelling. Now, those things can actually happen, believe it or not, sort of separately, that once usually an inflammatory cascade is initiated, it will stay sort of ringing from somewhere between 3 and 13 days, depending on sort of you and what's going on and the severity. So turn my ankle a little bit swollen, it heals itself really quickly, versus, hey, you know, that thing is really, really hot after a surgery and we're going to have to really stay on that inflammatory cycle for upwards of a couple weeks. But oftentimes, when people have sort of old and cold injuries, what we'll see is that there's old swelling in the body that our bodies or that we have failed to evacuate, to move through that lymphatic system. Now remember, part of the magic of the H-Wave is, number one, is we're bringing blood flow into this area, which is incredible, through muscle contraction by calling in and getting better dilation of the vasculature. But we're also using that muscle contraction to shuttle out all that lymphatic waste. And that waste is a normal byproduct of that inflammatory cascade. And if we were continually moving, because we would need to, then our lymphatic system by necessity would evacuate the swelling after this inflammatory result. But what ends up happening oftentimes is that we have sort of a poor management of that inflammatory cascade. We're not staying ahead and going ahead and dumping or decongesting or moving those waste fluids out through our lymphatic system because we're not getting muscle contraction. We're trying to isolate a system, and suddenly we're left with sort of this nebulous swelling in the joint. And that has happened now and will continue to happen even without sort of this hot sort of initial sprain, initial tissue trauma sort of that happens after an injury or surgery. And so we can sort of begin to divide that, which means that we can look at this inflammatory response and say, oh, let's do our best to sort of mitigate the swelling as a result from that. But afterwards, if that thing has gone kind of cold, then we can just get about management of that tissue. As a physical therapist, I regularly see people on both sides. Hey, we've just sprained ourselves. Let's go ahead and manage that through pumping and movement of the sort of the muscles through the H-Wave. And then simultaneously, we show up with people who are coming to see me because they aren't having the healing response they want. And we have tissues that are congested, tissues that are swollen, tissues that are angry because we haven't evacuated that swelling appropriately. And finally, to confuse matters more, when we talk about sort of systemic inflammation, it's why we're saying, hey, let's not eat a ton of sugar, let's not eat a bunch of inflammatory foods that sort of cause background irritation, background sort of systemic inflammation in the body. So we're always looking at sort of in sort of musculoskeletal terms, we're looking at, hey, how do I reduce total inflammatory load on the body by not drinking alcohol and eating cake late at night when I'm a super stressed human? But simultaneously, normally we're talking about this acute inflammatory response and swelling and management of those things. So hopefully that gives you better ideas when people bandy about these words, what we're talking about. Yes, we're always looking at managing systemic inflammation in the body, but when we're injured, that inflammatory cascade is how our body heals itself, and the swelling is a result of that inflammatory cascade. So let's go ahead and do ourselves a favor and manage that swelling.